Hi everyone. For this community mental health agency assignment, I selected the population of survivors of sexual assault. I chose this population because sexual trauma has profound psychological, relational, and systemic impacts. Survivors often experience PTSD symptoms, depression, anxiety, shame, disassociation, relationship difficulties, and barriers to accessing care due to stigma or fear of not being believed. Sexual assault also intersects with systemic issues including gender based violence, power inequities, and disparities affecting marginalized communities. The nonprofit agency I selected is Waymakers Sexual Assault Victim Services, also known as SAVES, in Orange County, California. Waymaker is a well established nonprofit organization that provides comprehensive victim services, including crisis intervention, forensic advocacy, counseling, and prevention education. Their target population is adults and child survivors of sexual assault, survivors of human trafficking, survivors of dating and domestic violence, secondary victims such as family members as well. Their services are designed to support survivors from the immediate aftermath of assault through long-term healing. Waymakers operates as a non-profit community-based organization. Their sexual assault victim services programs include 24-hour crisis hotline, in-person hospital accompaniment during forensic exams, court accompanied and advocacy, individual counseling, support groups, prevention, and education programs. The agency is primarily grant funded, including federal and state victim assistance funding, county contracts, and private donations. As a nonprofit, services are provided free of charge to survivors, which significantly reduces financial barriers. The level of care is outpatient and crisis based, not residential, detox, PHP, or IOP. However, they provide immediate crisis response and ongoing trauma informed counseling. Their advocacy team collaborates with hospitals, law enforcement, and the court system, making this a highly integrated, multi systemic agency. Referral sources include law enforcement, hospitals and SART centers, schools, self referrals through the hotline, and community agencies. Waymakers also offers multilingual services and culturally responsive programming, which is essential in diverse communities. I researched the agency through its website and public materials. I contacted Waymakers via their listed phone number and spoke with a representative from the Sexual Assault Victim Services Program. During the conversation, I asked about counseling services and duration, funding structure, referral processes, and barriers survivors face. I learned that survivors can receive short-term trauma-informed therapy and referrals for long-term services are provided when needed. I also learned that many survivors first engage with services through hospital accompaniment and that building trust is critical as many survivors initially hesitate to seek therapy due to their fear of the stigma. Waymakers uses trauma-informed survivor-centered approach. While they do not publicly list a specified branded model like TF, CBT, or EMDR on their website, their framework aligns with trauma-informed principles such as safety, choice, collaboration, empowerment, and cultural humility. This approach is appropriate for sexual assault survivors because trauma impacts nervous system regulation, attachment systems, and perceptions of safety. A survivor-centered model restores agency and avoids replicating power imbalances. Strengths of the agency include the 24-hour crisis access, free services, multi-system advocacy, which includes legal, medical, court, etc., prevention programming, and accessibility for marginalized survivors. One potential limitation is that crisis-focused agencies sometimes have high caseloads, which can limit long-term therapy availability. However, their referral network appears strong, helping bridge that gap. Overall, I believe the agency is highly effective in addressing both the immediate and long-term needs of survivors. 3 additional community resources I came across to build a strong referral list for sexual assault survivors are the following I identified. RAIN, which stands for Rape, Abuse, and Incest National Network. RAIN operates the National Sexual Assault Hotline, which is 800-656-HOPE, and provides confidential online chat services. They connect survivors to local resources nationwide. Another one is Laura's House, which is in Orange County. Laura's House provides shelter, counseling, legal advocacy, and prevention education for survivors of domestic and sexual violence. And third is Human Options, also in Orange County. Human Options provides trauma-informed therapy, housing assistance, legal advocacy, and safety planning for survivors of relationship violence and sexual abuse. These resources expand the referral network to include housing, shelter, and national crisis support. Survivors of sexual assault face multiple barriers, including shame and self-blame, fear of not being believed, fear of retaliation, immigration concerns, cultural stigma, financial limitations, lack of transportation, limited language access, distrust of systems, especially law enforcement. Marginalized survivors, including LGBTQIA+ individuals, undocumented individuals, and people of color, may experience additional systemic barriers and discrimination. Without agencies like Waymakers, many survivors may never access services due to these barriers. My personal impression of Waymakers is very positive. I appreciate that they integrate systemic advocacy with mental health services. They do not isolate therapy from the survivor's legal and medical realities. Instead, they provide holistic support. From a systemic and relational lens, as an MFT trainee, this model aligns strongly with community mental health principles. Sexual assault does not just affect individuals, it impacts family systems, relationships, and communities. Agencies that integrate advocacy, counseling, and prevention demonstrate a broader ecological understanding of trauma. I also believe Waymaker shows strong commitment to inclusivity, offering multilingual services and free access. Accessibility is crucial for marginalized populations who may otherwise avoid care. Overall, this assignment deepened my understanding of how specialized community agencies function as both clinical and systemic support systems for vulnerable populations. Thank you.